If you are a man who has been unable to conceive with his partner, or you experience symptoms like depression, low mood and low libido and or erectile dysfunction, then this is something which is called male infertility. And today I'm going to tell you the reasons and tests that you can do to get to the bottom of it. I'm Dr. Bhargav Raut, the Chief Pathologist at Pathofast Lab and Diagnostic Center in Pune. We do lab tests, blood tests and many investigations for patients of different diseases. Before proceeding, I want you to be sure that you are watching the right video for your problem. Please take a look at this checklist. Have you been trying unprotected intercourse for at least 1 year with your partner and still haven't been able to conceive? Also, have you made sure that your partner has been tested for all possible fertility problems and everything in her case is normal? If you have answered yes to both these questions, then please continue watching this video because you will definitely benefit from it. If not, please make sure that your partner has been completely tested for all the female fertility parameters before going ahead. The first and most common cause for male infertility are abnormal hormone levels. In this, we want to be sure that your testosterone levels are okay, that the hormones that are secreted from your brain, which cause your testicles to produce the sperms, are also in normal levels. And we also want to be sure that you don't have any other metabolic conditions. So I'm now going to tell you which tests to do and how they matter. So there are 3 basic tests that you need to get done. All these are 3 simple blood tests that you can do from the same blood sample. There's nothing complicated about it. You don't need to do any special preparation. You can give the sample anytime. First and most important is the total testosterone level. A low level of testosterone definitely points to a problem with your fertility apparatus and you need to consult your doctor as to why it is low. The second is called the FSH level or the follicle stimulating hormone. Either a very low level of FSH or a very high level of FSH both point to a problem in your fertility apparatus. A high FSH level tells us there's something wrong with your testicles and they are not making the sperms properly. A low level of FSH tells us that there is something wrong in the gland in your brain which is required to stimulate this FSH. And that both of these are problematic. The last I've included is the HbA1c level, which gives us an idea of whether you are diabetic or pre-diabetic. High blood sugar levels, insulin tolerance, insulin sensitivity issues, as well as weight gain will all probably derange your HbA1c level and push it above 6.4, which is considered to be the cutoff for diabetes. So please get these 3 tests done. A high HbA1c level means you need to cut your weight, and this could be one of the main reasons why your sperm production is not as good as it should be. The other 2 hormones are equally important. The next but a very common problem which we find is something called a varicocele. What this basically means is that there are many small tiny little veins in your testicles, and sometimes one of these or a bunch of these get bunched together and form something like a balloon or a ball, which is called a varicocele. This can affect the sperm production in your testes, and it can also sometimes cause a problem in the way the sperms travel through the testes. This can be very easily tested, and I'm going to tell you which test you can do for this. You need to visit a sonologist or a radiologist and get an ultrasound scan of your testicles done. This is the best way to look for a varicocele, and your radiologist will be able to tell you immediately whether it is there or not. There's no other test that you need to do to check for this. Infections are another very common cause because of which your sperm production is not taking place normally, or the sperms are not being able to travel out together with your ejaculate. These include viral infections, bacterial infections, and many other STDs or sexually transmitted diseases. And I'm going to tell you which tests can easily tell you whether you have one of these. So you can easily do a test called the Chlamydia and Gonorrhea PCR. The best part about this test is that it is just done on your simple urine sample, so you don't even need a needle prick, you don't need to feel any pain to give even a blood sample. This is done on your urine sample itself. Together with this, we also advise something called a semen culture test, which is a simple test in which you provide your semen sample or your ejaculate, and we check whether there are already any bacteria which are growing on that, because that can point to an infection. If you are positive for any of these 3, you can easily get treated for this and it will immediately improve your chances of fertility. The next possibility because of which you are suffering from this infertility are genetic problems. Sometimes there are abnormal chromosomes, abnormal numbers of chromosomes, or problems in the chromosomes themselves, and this is something that is passed down to you when you are a child. Now you need to evaluate whether there is one of these problems in your case, and this can be done with a bunch of very simple tests. There are also certain things which are called genetic abnormalities in the genes, which give rise to a problem in the way in which your sperms travel through your testes. We check for this by a certain specific genetic test, which I will also tell you. But if your sperms don't travel properly through the testes and into your ejaculate, it is easy to understand that you cannot conceive. So let's take a look at those tests. The genetic tests are called something which is known as karyotyping. This is another thing which is done on your blood sample. You don't have to do any special preparation from this. It will be done on a single blood sample, and the lab will look for certain changes in your chromosomes. So the normal chromosome should be like 46XY in men, and we also don't want anything wrong with the Y chromosome, which is the main chromosome because of which you are a man. And lastly, we also check for something called the CFTR gene mutation, because this will point to something wrong in the way in which the sperms are traveling through your testes. So as long as all these three things are normal, you can probably rule out any kind of genetic cause because of which you are suffering from infertility. Now the last, but of course the most important of these, is the checking whether your sperm count is even normal or not. This is called anything wrong with your testicles can cause this problem. Maybe there is an obstruction, maybe the sperms are themselves not being produced, maybe their shape or size is not normal, maybe they are not moving properly. But all these things can be covered under just one single test, which I will now elaborate finally. So to check your entire sperm condition, you just need one test, which is called the semen analysis test or the sperm analysis test. It is also called the HSA test or a spermiogram. In this, we check the total number of sperms, the concentration of the sperms, whether the sperms are moving properly or not, what percentage of your sperms is alive, what is the size and shape of the sperms. All these things are checked under this one single test, and it is very crucial to get this test done, because any derangement in these numbers will definitely affect your fertility.